Japan and Kenya have been collaborating for over 40 years to develop Kenya's health sector. Health research is one flagship area of this cooperation.
JICA was able to break through a very major block to us in terms of development of research and therefore development of the health sector. Because through research in health sector, you can develop all the other areas. I think what JICA values most is that they do a good job and that they improve the situation. I think they bring with them the Japanese approach. And I think the Japanese approach is a very serious approach to professional work. The Japanese approach, they want to be successful, and they do things in a serious way. So without the community level, you cannot have universal health coverage in Africa.
Communities in Kenya face high burden of disease from communicable conditions such as HIV and AIDS, tuberculosis, and malaria. Kenya Medical Research Institute, KEMRI, has been leading research into these communicable diseases.
KEMRI was established back in 1979, and during that time we had a very humble beginning. It was just a mere 5 people, 2 of who were scientists and 3 were just support staff. But later on, with this kind of collaboration and partnership between KEMRI and JICA took it upon themselves to support this development of their infrastructure in terms of buildings and equipment in KEMRI. So I can tell you for sure, the entire campus, main campus in Nairobi, which is where we are sitting now, was actually supported and constructed by JICA. The other thing that I should talk about is about human resource development, particularly scientific. Over the time, from the initial time that KEMRI was actually supported by JICA, there's a lot of training also that has been provided to our scientists. We have about 200 scientists to date that have been trained to PhD, master's and PhD level. And most of these, a large number of these have been trained in Japan.
Scientists like Dr. Alan Olekwala have benefited from the JICA capacity building program.
The strength of having capacity building in African countries cannot be more expounded. And indeed, I am one of the beneficiaries, because in the year 2012 to 2017, I worked under a SATREPS project on development of novel Rift Valley fever and yellow fever kits, and wherein we worked closely with Dr. Shingo Inoue from Nagasaki University under the supervision of Professor Morita Koichi, and also in the Kenyan side at that time Professor Matilu Mwau, wherein this collaboration enabled me to pursue a PhD in the field of molecular biology.
Dr. Alan Olekwala has also been involved in strengthening regional laboratory capacity through the JICA Third Country Training Program.
The Third Country Training Program is a program that is geared towards assisting African countries, and in this particular case, the theme is building resilience against public health emergencies in Eastern Africa.
The COVID-19 pandemic is an unprecedented public health emergency of our time. Using assets from JICA Corporation, KEMRI has been at the forefront in responding to the pandemic. And in November 2020, KEMRI was awarded the JICA President Award 2020 in recognition of its regional contributions through conducting research and advancing human resource development. Mr. Komori Katsutoshi, Chief Representative of Kenya JICA Office, presented the award to KEMRI on 19th November 2020.
To appreciate JICA. I want JICA to be in the middle. It has already been. It is the one that initiated the infrastructure here. I want them to be in the middle of supporting KEMRI, and I think in the near future we will not regret anything about what JICA has done to KEMRI and the scientists and the entire community of this nation.